All right, well, I guess lettuce-gate is what some people are calling it, this foliage-fueled parasite outbreak. It's spreading across the country and spreading fast. So the CDC says it now has an outbreak on its hands in 9 states. Those numbers, though, appear to be lagging well behind what we're hearing from the states themselves, states that include Michigan, where cases with new numbers just out topped 9,200. See there on the left side of your screen. Let's bring Dr. Angela Rasmussen in on this, a virologist and science chair of the Save America movement. Dr. Rasmussen, thank you. So I just have 2 maps here to illustrate that point from the telestrator. So the 9 states, and a lot of them are clustered in the Midwest and the upper Midwest. That's the outbreak according to the CDC. But what I mean by other states are saying it, like if you just look at the cases map, I believe it's reached now 41 states. So what would you say about this situation and how long it's taking to control it?
Well, I think that it's actually quite predictable that it's taking so long to control this. One of the things that I've been doing with the Save America movement is we're actually trying to quantify some of the impacts that some of these changes are having on our federal government and its function. And one of those things is food safety inspections. So I looked at a map and at the CDC and USDA and FDA data about produce inspections, and it turns out that in every state, whether it is part of this cluster or not, every state virtually, with the exception of California, that has cyclospora cases, has had a significant reduction in funding that supports these food safety inspections. So I think it's really important for people to understand that one of the reasons that we're seeing so many more of these foodborne outbreaks is that we no longer have the ability to inspect and to actually look out for them.
If that's the case, does it mean that we'll see more of these types of things, in your opinion?
In my opinion, I think that's exactly what we would expect, and that's certainly what the evidence suggests is going to happen. We've seen other outbreaks of foodborne illness occurring as well. We've seen several salmonella outbreaks. We're seeing these actually tick up, and it doesn't seem to be because our food is necessarily less safe. It's because food that's not safe is actually getting through checkpoints where it would have been caught before.
They asked Scott Gottlieb, who used to be the FDA commissioner on one of the Sunday shows, his opinion on whether this outbreak is under control. And here's how he put it, the context he put it in.
I don't think it's under control yet, per se. I think that they've done a good job, FDA has, isolating this to central Mexico and some specific farms as well. I don't think this is fully under control yet because we don't know for sure that that's the only growing region where this is coming from, but it does seem to be the case at this point.
Well, what you're adding, it seems to me, Dr. Rasmussen, is that there's a reason for that. And the reason, you're drawing a direct line from the cuts that we saw in public health to what we're seeing in an outbreak like this.
That's absolutely right. And so I do think that Commissioner Gottlieb is correct in that the FDA has done a good job in terms of tracing this to this farm in Mexico, Taylor Farms, but it's not clear that that's actually where it's coming from because there has not yet been a single positive test for this parasite. The testing is actually not great, and so it's very difficult to test reliably for this. We can't just start testing all the lettuce because the testing doesn't work very well.
Is there anything different in our current kind of parameters that we have that we should be doing that we're not doing? In other words, I know the cuts have been made, and you say that's had an impact. Is there anything else that we should be looking at?
So I think one thing people should understand is that these are not just cuts in terms of food safety inspections. These are also cuts in terms of things that the federal government does that supports the state government. So you mentioned earlier that there's a discrepancy in terms of case numbers between states and what the CDC is reporting. And that's largely because the CDC would compile this data from state, local, and health departments and food inspectors, and then they would put it all together. And now some of those food inspectors are no longer being paid, so they're not getting that data. That data flow is not working. So it's not just the food safety inspection that we're losing capacity on. We're losing capacity at all these other functions that nobody really appreciated the federal government did until we lost them.
What are you most worried about then? I don't want to, minimize the effect of this parasitic outbreak by any means. Nobody wants to get it. But what are you most worried about?
Certainly. I mean, I definitely don't want any sort of explosive diarrhea, and a lot of these foodborne illnesses can cause that.
Yeah.
I'm a lot more worried about something like H5N1 avian influenza, and that's actually the basis of my expertise in terms of food safety is inspection for viruses like that have the potential to cause a pandemic. Because if we're not able to control something that's actually relatively treatable, it's relatively controllable if you can diagnose it and test it, what are we going to do if it's an influenza pandemic?
Right.
I mean, if we don't have this capacity nationwide.
That worry is exacerbated for the same reasons.
For many of the same reasons. So a lot of the analogous departments have also suffered similar cuts. Certainly the people who process the data at the federal level and the people who communicate with the states. This has already happened in the measles outbreak in West Texas, where basically the states and the federal government were having a really difficult time talking to each other. So it causes a real problem if you've got something that's fast moving and it infects a lot more people than cyclospora does.
Makes sense. Dr. Angela Rasmussen, thank you for your expertise. I'm Connell McShane. We are live at 5 here in New York, where we have the news for all Americans.